Okay, I'm going to try this again. Welcome to the Syscom Cybercast, episode 2. This is the second take of this. I did film the podcast already uh, once today. So I'm getting a lot of good practice. Of course, I have this sweet mic. I'm not going to drop a fire freestyle, but I am definitely tempted to. So, but I will spare everybody my genius. So, anyways, um, this week we're delving into this episode 2, delving into behavioral health reporting opportunities and issues. Just doing a little housekeeping before we start again. Uh, these podcasts will cover kind of monthly themes. This month was behavioral health. An industry or vertical that we're really versed in at Syscom. So next month is probably going to be urgent care groups. But this month we'll finish out with behavioral health. Drop another podcast next week. I am in the midst of getting ready to travel out of state here for the next 2 weeks. So I will be on the road, but I will have my podcast equipment with me. So for all the fans out there, it will be ready. Again, this week will be late because I'm having to reshoot this, but no problem. We'll get through the issues. But one item I would like to just highlight: anybody viewing, anybody that's subscribed to us on any socials or listen to this podcast, please feel free to give us some feedback on improvements or topics you'd like to see. Uh, of course, if there's any questions on any of the topics that we're discussing, um, please let us know. We're always happy to talk. So, without much further ado, we will get into behavioral health reporting. Just a little background on it. Um, it's I don't want to say generic, but every single business really, reporting is key, especially nowadays with technology, dynamic. Real time reports are always optimal. In behavioral health, a lot of times you're dealing with grants, you're dealing with reporting for some sort of regulatory agency. So having reports that you can trust, the data, being able to pull it quickly, is paramount. Some of these reports, are on demographics, health outcomes, the populations, different things, and a lot of times a behavioral health practice will have an EHR. Uh, a lot of times you can pull reports out of that, but you're not getting the data you need to report to, like taking that data a step further and kind of analyzing it, I guess. So you're not able to really present it to a board or an agency. And so the EHR is lacking in that. Now they do have modules that you can add on to, excuse me, and get some of those metrics, but they could be costly. And a lot of times what you'll see is behavioral health is having to do a lot of this report and analysis manually. And so, some going into some of the challenges, obviously the manual input cost per hit, kind of cost of a module that will actually work on the EHR, because a lot of the EHRs are not out of the box, optimized for behavioral health. Um, so you kind of have to make some of the data work for you or get like a custom report written. All of this can be very costly. And then with that too, a large behavioral health um, organization that has multiple programs. So they have a community clinic, they have, you know, maybe detox or those type of things. Um, they'll have an EHR, but it might not work for every single program. And so it's not one size fits all. And you're trying to fit a program into a certain EHR, and then you don't want to have two systems either. Uh, so sometimes an EHR, I'm not saying EHR, a behavioral health practice will have like a custom solution that that's built in house. They'll use like maybe some sort of database software or what have you. The problem with that a lot of times, if it's a smaller practice, say under 200 employees, there's only going to be one person that manages and maintains that. Something happens to that person, they leave. Uh, that knowledge has to be transferred, and the upkeep has to be passed on to somebody, and that a lot of times does not happen. And then you're kind of left back at square one. And if you have something like that, you really need a team of people. So these are some of the kind of the brief challenges that people face with their reporting, and trying to get useful data. I've been told that I need to transition a little easier into the ad read, which of course this podcast is sponsored by Syscom. Syscom's a world class managed IT company that serves the Southeast and beyond. We specialize in cybersecurity, cloud migrations, project management, access control, and surveillance, to name a few. If you need help getting your technology in order, give us a call or email today, 866-249-7636, or email us at sales@syscomllc.com. Okay, now that that's got out of the way, we can actually talk about some solutions for reporting. Uh, Here at Syscom, we support both Google and Microsoft. Office 365. Our customers are a mix, but mostly behavioral health, and most of our customers are on Microsoft Office 365 and 365. And when we encounter a customer that has that Microsoft environment available to them, our recommendation is usually to go to Power BI. And what Power BI is, to be simple, and kind of break it down, is it just it takes your data from your Microsoft environment or any type of data, and it helps you build dashboards. It helps with analysis. And not to dive so deep into licensing, one of the easy to start advantages of it is it comes with the E5 licensing. So that license can be applied to a user, and they'll have Power BI available to them. And a lot of times those will be decision makers that you would suggest it for, of course. And not to get into the different levels of licensing, but an E5 is like Microsoft's enterprise advanced licensing. It is, dramatic. I don't want to say dramatically, but it is more costly per month. And you could also buy Power BI as a standalone for your practice, or Power BI desktop. So there's different options there, but for our purposes, we'll just kind of discuss the the ease of applying an E5 license. Say you have 5 to 10 people that need to be looking at these reports. You apply 5 of those E5 licenses, and there you go. Um, so going into some more discussion on this, our our kind of aim and how we'll kind of angle this for our discussion is dealing with a nonprofit, just because, and it works for an organization that's not a nonprofit as well. But really and truly, nonprofits are a huge advantage here because they get discounted pricing on Microsoft licensing. So they'll get a heavily discounted E5 license that's usually $60 per user per month, around there, I think. And a lot of times they're not aware that they can utilize this, or they might already have some of this licensing. One thing that's cool about Microsoft, you can get a try out something, and I think you can even extend it sometimes, and that's super helpful to onboard something. And a lot of times, you know, a organization will be using like Office 365. They'll already be using some of the apps, or like Microsoft Forms, different things within their suite to collect data. So it's not a big lift to get some of that data. You just kind of have to build some of those receptacles, I guess, data collection points, to get it into Power BI. You can use Power Automate, or what used to be called Microsoft Flow, to kind of power some of that movement of data to Power BI. So it's a really, it's just like any other software. You have to onboard it, train, communicate, those type of things, and get it adopted. But it's a really easy to start. And at Syscom, we this is usually the direction we'll kind of guide our behavioral health customers in when they're coming to us, say, hey, how do we analyze our data better? How can we have a dashboard? What can we do? What can we do? Our staff spend a ton of time each year when it's time to test for this or that. What kind of software can we onboard? And it's Power BI is, and they've only made it better, I think. So it's a very dynamic and useful tool. Going into some of the advantages of it, just to list them, you know, the initial investment, it's not, I mean, I think you can pay for a year of an E5 license, or I think you can buy the standalone product. It's not tremendously, costly. It's also, you can pay monthly, and of course you can cancel. You can have that trial, like I said. So that's another advantage of it. It's not like I'm buying a $20,000 license of a software, and it's Microsoft. So you can be on a monthly plan. Say, hey, this isn't working after 3 months, and get rid of it. Um, of course, reporting will certainly improve. You can, if you're at a behavioral health practice, if you're needing grants, if you're trying to attest, all of that will improve. You're able to pull reports and say, hey, this is this is who we saw this past quarter or past year, and that's going to help you make better business decisions, and you can aim the organization at providing better care based on the data you're getting. Just because you can hire, staff that's needed, you can say, hey, there's a problem here that we're seeing come in. Let's start a program, kind of angled at helping this certain population that's coming in. Uh, so that's the power of using this. And I wanted to kind of discuss a case study. Obviously, I'm not going to divulge any customer information, but I did want to kind of talk about an experience we had at Syscom. Years ago, we onboarded a large nonprofit behavioral health. They had an EHR that they purchased like a long term. And again, that's another tip. If anybody's listening, be wary of long-term contracts, especially with internet service providers and telephones and those type of things. Don't get into a 5-year contract. Things change so fast, and you don't want to be locked in. Just a little side note there for the viewers. Um, we run into that quite a bit, and you get in unfortunate situations with getting out of those type of contracts. But back to this case study. Uh, they had an EHR that they had purchased years ago, and they were a long term contract, very adversarial relationship for a technology vendor, and they could not pull reports. They had multiple different programs. The EHR might have worked for this one program well, but it didn't meet the needs of something else that they were providing, and so it was super frustrating for the customer. They couldn't pull reports quickly to the board. They actually had a custom solution built that was working, but again, the person was running around trying to put out fires. Um, they also had a Microsoft environment that they weren't utilizing. We got them on board with using that Microsoft environment, upgraded their licensing for their decision makers, helped them build out dashboards in Power BI, and then we help them build forms, different data collection points where they could put information and data, and we use Power Automate at that time. I think it was Flow, and they were able to really get some dynamic dashboards and do a great job at making decisions. So it was a win-win. We actually helped them save money with their licensing. Which is what we do with budgeting and different things. So it was a great case study. I thought I'd just kind of highlight it at the end here. So to close, it's obvious that reporting is important for a behavioral health practice, or any business really. And a lot of times these legacy type of software EHRs and stuff make things difficult, make it manual, put a lot of stress on your staff. You can utilize technology to build dashboards, specifically Microsoft Power BI. Someone like Syscom and MSP is going to be able to help you guide you and get to you know be efficient with your licensing, and get you to a point where you can start collecting data and help maintain that environment and have dashboards and things. So if this is something you're interested in finding out more about, give us a call or email, reach out via socials. Um, we're always happy to talk. So that's all we have for this week. I appreciate the viewership. I will say, if you have any feedback or topics you'd like to hear about, definitely let us know. I'm always looking